Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Good afternoon, everyone. It's great to have all of you here. That was really, I hope all of you had a chance to be at the session. That was a wonderful way to end the session. And really welcome you here today. My name is David Lee, and I am the Director of Prevention Services at the California Coalition Against Sexual Assault. We also have the National Prevent Connect project, and we also are part of the new national entity Reliance. So really glad to see so many people here talking about ways to be able to prevent sexual violence on college campuses, such an important topic. It looks like we might even be getting to the place where we're going to fill up the room. This has been a very exciting project that we have been able to work together, and you're getting to see a wonderful collaboration of working with the Centers for Disease Control, the American Public Health Association, 15 state health departments, and Prevent Connect was able to support this effort in being able to do this. So I'm really excited to be able to share about the work that we're doing to be able to build action plans to do this work. So my role is actually the easiest because I just get up and say hello and welcome you, tell a joke or two, and then more importantly, really go to our presenters, and I'm going to have them introduce themselves. So I'll start with Yvonne in the moment this way. And you have to go speak here so we can get the recording.
Hi, everybody. I'm Yvonne Knoyer. I'm the Prevention Program Manager at the Minnesota Coalition Against Sexual Assault.
Hello, good afternoon. I'm Ashley Klein, a Training and Technical Assistance Coordinator at CalCASA and Prevent Connect.
Good afternoon, everyone. I'm Mighty Fine, Deputy Director of the Center for Professional Development, Public Health Systems and Partnerships at the American Public Health Association.
And hi, I'm Jenny Dills. I'm with the Centers for Disease Control and Prevention in the Division of Violence Prevention. And I'm kicking it off, so David says take it away. So what we wanted to share with you this afternoon, first of all, thanks for coming. I know if your lunch was like my lunch, it was very fast, and then there was this brilliant plenary, and my head is spinning. So thanks for coming and joining us this afternoon. We want to talk about this collaboration that David mentioned that was a partnership between CDC, CalCASA, Prevent Connect's project, and APHA to bring together experts in the field of sexual violence prevention on college and university campuses and state health departments who implement the Rape Prevention Education Program to find out what's working best to prevent violence. So we'll talk about the action planning process. We'll describe the framework that we use to guide our work, and we will talk about next steps. What will happen in the next year or so? And I just realized now it's right in front of me, so I don't have to look backwards. So this probably looks very familiar to you all, the Not Alone report from the Task Force to Protect Students from Sexual Assault, which was a task force that the White House obviously convened in 2014. In April of 2014, they released this report, which had a number of recommendations and a number of action steps for federal agencies and partners to take. CDC specifically was asked to pull together an expert panel and to then follow the expert panel, what recommendations came out of that, follow that up with an action planning meeting where we would convene state health departments to come up with a multi-year action plan for prevention on college and university campuses. So we had a really, in addition to the folks that we worked with nationally, we had federal partners that we partnered with as well. The Office on Violence Against Women, the Department of Education's Clery and Title IX offices, the Department of Justice's SMART office. It was this really cool collaboration where everyone was talking about prevention from the same lens and with the same goals in mind. So we held our expert panel, which we called a think tank, in May of 2015. It feels like it was just yesterday, and I have no idea how is it September yet? No, tomorrow. But we're almost there, so this was over a year ago. So what we did is we pulled together over 30 of the best minds in the field, researchers, practitioners, health departments, sexual violence coalition staff, we had students. So we pulled together over 30 folks to brainstorm what's working in the field and where are there gaps. You'll hear from Ashley about the scan that Prevent Connect did for us to take a look at a national level, what was happening, what was working across campuses. So we had that to lay the foundation for us at the meeting, and then we really just went more in depth. We used the social ecological model, which you know CDC uses and loves. We used the social ecological model as a framework to guide our discussions, to talk about what's currently happening, what infrastructures and policies are currently in place, what were people hoping to try, what was their momentum for, what were there some barriers to implementing. So we walked through developing vision statements and mission statements and a SWOT analysis to really kind of dive into coming up with a grouping of recommendations that we could offer to the field. So that was kind of the framework for the day. We talked about lessons learned, we talked about what systems were in place, and with the ultimate goal of being able to make recommendations at the end of the meeting. So where we landed were these 5 components. These 5 pieces make up kind of the current thinking from CDC and partners about what is working to prevent sexual violence. So making sure you identify audiences that, oh wait, I have a slide for this. So it's audiences, comprehensive prevention, infrastructure, partnerships and sustainability, and evaluation. So these were the components that we took forward to share broadly with the field as well as with the action planning teams who we convened later that year. So the first component, comprehensive prevention. This includes having a multi-sector approach, partnering with folks across campus and community, coordinating across prevention and response, and working specifically to address gender-based violence. Infrastructure, we heard over and over the need to have a dedicated prevention staff person. Where possible, we know that's not always possible, but having someone who can solely focus on prevention and help to institutionalize prevention across the organization, across the school, and that can lead a team, a work group, or a committee that pulls together campus services, law enforcement, all the folks across campus that have a stake and a role to play in campus violence prevention. For audience, we heard that it's very important to identify champions, folks who can be the messenger and have that message be meaningful to the audience that hears it. So not only administrators, but students, student leaders, faculty and staff. Planning for different types of institutions, we also heard was very important. I think we come to this work and often go to kind of a 4-year public institution as the place where we can do the most, have the most kind of impact, but there are tons and tons of types of colleges and universities where students are also experiencing assault, and so tailoring your prevention work to meet the needs of those schools as well, and then tailoring community-specific work for your prevention as well. Partnerships and sustainability, we heard about fabulous partnerships, developing MOUs with community partners and community law enforcement, ensuring leadership buy-in, and engaging students in the planning and programming. And finally, it wouldn't be a CDC anything without some talk about evaluation. We, where possible, would love to see rigorously evaluated prevention programs, practices, and policies. We want to know what works. We want to be able to replicate it. We want to build capacity for evaluation, finding those partnerships with graduate students and faculty who are involved in research and evaluation, and partnering within the school and within the community, and then focusing on outcomes for reductions in perpetration being the ultimate goal. So then in July, we had this kind of big list of things that we wanted folks to do, and we convened 15 states highlighted on this map. We wanted to bring together so many more, but APHA was really planning this meeting, and it's just hard to bring more than 15 states together. So it ended up being 75 people. States applied to attend with their team, which included campus and university, staff, faculty, administrators, the Sexual Violence Coalition, state coalition was represented, and then the RPE coordinator or director from the state health department. So these teams came down, we spent 2 days kind of locked in a room at CDC, and we just really went in depth into this process of setting the stage. We heard an update on the national scan, which you'll get to hear about too. Teams did mission and vision statement development. They talked about the current landscape nationally as well as in their states and in their communities. We did a SWOT analysis, and finally we dug into action planning. We honestly needed a third day once we finally got to the action planning. But we had some fabulous states walk away with plans to implement practices, policies, new procedures in their communities and on their campuses, and that's what we'll hear about later in the hour. So I think that's me. Thank you.
Hello, everyone. Thank you, Jenny, for setting this up so nicely. And so I'm going to give just kind of a brief overview of some of what we cover in the scan. And we actually have some hard copies at the CalCasa booth in the exhibitor hall. So if you want to look into that, I welcome you to visit. But I'm going to give a brief overview of the scan, and then we'll hear from Mighty about really how do you implement an action plan, and then Yvonne will share some lessons learned. So the scan really did come out of an ask from CDC to do an environmental scan of sexual violence prevention on college campuses across the United States. And we used several different methodologies in doing the scan. And so we did interviews with key informants, so folks who were stakeholders in sexual violence prevention. We talked to campuses, and we were really hearing about promising practices in terms of sexual violence prevention, also some of the top challenges and gaps, and then considerations that campuses really must address. We also conducted a literature review, and we really drew on experience that CalCasa and Prevent Connect has for doing many years of work and providing technical assistance to campuses and through our web conferences. And so this scan was completed in late 2014. And so yes, that was a while ago, and there have been many changes since then. We've seen campus sexual assault really become a spotlight issue, right? There have been so many things come out every day. We just heard all of the amazing work that the Office of the Vice President is doing. We've had The Hunting Ground become a major documentary that has really been a catalyst for folks talking about these issues. It took a focal point at the 2016 Oscars with Lady Gaga performing. The Vice President was there speaking about campus sexual assault. Just recently, the White House sponsored the United States of Women Summit here in DC, and campus sexual assault was a conversation that our federal leaders were having. The NSVRC had their whole Sexual Assault Awareness Month theme around campus sexual assault in 2015. And it wasn't very long ago that literally millions of people read the impact statement from the survivor in the Stanford case. So really this is a huge issue, and there's new research, there's new articles, there's new discussions that are coming out every single day. What hasn't changed is this three-prong approach that CalCASA identified to effectively address and prevent sexual, domestic, dating, and stalking violence on college campuses. So I'm going to give you a brief overview of that. First, we know that things need to be trauma-informed. We know that even if prevention programs aren't specifically geared towards survivors, there are survivors in every audience. So we really need to come from a place of being trauma-informed. We also need to realize that survivors' needs vary, right? What one survivor needs might not be what the next survivor needs. We also know that doing prevention work often is a catalyst for disclosures of sexual violence. And so prevention practitioners need to understand how to respond when they're met with those disclosures. And then we need policies that say what they do and do what they say. The second prong is really about community collaboration and engagement. And this is huge. I was in a workshop this morning, and the presenters were talking about the fact that campuses are really part of a larger community, right? And so it serves all of us if we work together. College campuses are not the only places where sexual violence occurs, and they really shouldn't be asked to be the only ones to fix the problem, right? It's not possible, first of all. We all need to come together. So partnerships between on and off campus entities are really important, partnering with rape crisis centers, with coalitions, with public health departments. We also know that universities and communities have a symbiotic relationship. So maybe there are many students that live on campus, but all students go out into the community. They all access the community, and so that relationship is really important. And then the third, which I'm going to go into a little bit deeper, is around this idea of comprehensive prevention. So we know that there is no one strategy that can be as effective as multiple strategies. We also know that we need to really work, and Jenny mentioned the social ecological model, we need to work across all of those levels. We can't just stay in that individual and relationship level. We really have to work across and have our prevention strategies reach all of those levels. And then finally, we cannot sprinkle our prevention efforts. We really need to saturate the campuses and the communities. And so we'll go a little bit deeper into what this means. So one of the things that Prevent Connect Campus has been highlighting is really this need for prevention to be intentional, strategic, and comprehensive. And so intentional, what does that mean? Well, we know that violence doesn't just happen, and neither does culture change. Right? We do it intentionally. We see a problem and we figure out ways to respond to it. And so our prevention efforts really need to be intentional. They also need to be strategic. What works on one campus might not work on another. So it's really important that we understand the culture of the campus that we're working on, and we strategically figure out what makes sense on that campus. Also, strategically linking prevention messages to other messaging going on campus is a great way to saturate the campus and make sure that we're not just kind of doing one-offs, but we're really building momentum and sustainability. And then finally, back to this comprehensive piece, is that we really need to work across the social ecological model. And I really like this example that includes an institution level, right? It really shows that in order for us to create that deep culture change, that deep shift that we need in order to prevent violence, we have to work across the individual, relationship, community, institution, and societal level. And so our programs should reach across all those levels if we are going to make some change. And one of the ways to start, because that's not necessarily easy, but it's great to kind of map out the work that you're already doing. And so kind of taking inventory. What kind of advocacy work are you doing on campus? What outreach and awareness work? What risk reduction? And finally, what primary prevention? You might find that you're doing a lot of work in one of these areas and not in another. Okay? So this can be a really useful tool and seeing kind of where those gaps are, and making sure that primary prevention is part of that. Because while we need all of these areas, if we're going to change culture and prevent sexual violence, we really need to focus on primary prevention. And so that's really a great introduction to what we're going to be talking about as we go through this workshop, that we need a prevention plan. We need to plan this out. And so we need a mix of topics, so different elements. Again, there's not one strategy that will prevent sexual violence. We know that sexual violence happens for many different reasons. And so, are there many different approaches to take when we're trying to prevent it? Also a mix of dissemination models. So maybe we have policies being enacted on campus and events and workshops, right? Not just one Take Back the Night event every month of April. We really need a mix. And then a mix of partnerships, which I think you're gonna get a really good example of when Yvonne shares, is that we really need to bring folks together. These are some campus-based groups and constituencies that you might think about partnering with. And so residence life, athletics, ROTC, campus police, Title IX. But it's really important that it's tailored to your campus because, again, every campus is different, unique, has its own needs. And then, of course, those community-based organizations, so local rape crisis centers, state coalitions, health departments are great resources off campus to partner with. And then the other piece that I wanted to highlight from our scan are some challenges and opportunities when it comes to campus sexual violence prevention. And if you are interested in learning more about the scan, not only can you get a copy of it, but we have also done a podcast that's available on our website that goes a little bit deeper into some of these issues. But we know that there's really limited evidence about what works to prevent sexual violence on campus. So that's a gap, but it's also an opportunity because it tells us that we need to think of creative ways, right? And I heard Dr. Jim Mercy from CDC say in a meeting earlier this week that we can't wait for the perfect science to tell us what works. We have to act now. We also know that there's fragmentation, not just on campus, but in the community as a whole. We often work in silos. And so, again, that's a challenge, but it's also an opportunity for us to link our work and come together. There's no solution in a box. Wouldn't it be great if there was? Wouldn't it be great if we, instead of sharing this, handed you just a box of what will work to end sexual assault on your campus? That would be great. But there really isn't a solution in a box. And so we have to really stay away from thinking that there is and understanding that efforts need to be tailored to your campus community. You have to understand that culture. There's unique needs of each campus, specifically on historically marginalized communities. One of the things that I've really been thinking about lately and working with some community colleges is that community colleges are working with often less resources than a four-year school. And they have a really unique context of doing their work. But I think there's some really amazing lessons that we can learn in the work that they're doing. And so those campuses need to be included in our discussions. Oftentimes when we talk about campus sexual assault, we're not talking about all campuses, right? We're definitely leaving some folks out of the conversation. We really need to not only bring them into the conversation, but learn from them. We know that this is a complex issue. Right? And so to get to that shift that we need, it's going to be complex. It's not going to happen in a year, maybe. Prevention planning takes time, and it's a process. I'm sure Yvonne can share that, can speak to that. We also need to make sure that we really retain this context of gender equity, keep this perspective in the sexual assault prevention that we do. Some programs don't include a gender equity perspective, but the way that gender influences culture is really important when we're trying to prevent sexual violence. And then finally, measuring success is also a challenge. It can be really difficult to measure if our programs are succeeding, but it's equally as important to do so. We don't have a good baseline when it comes to sexual violence. So, with that, I'm going to hand it over to Mighty to talk a little bit more like, how do we plan this? What is this planning? Thank you.
So I don't know if it's because I just came from a youth summit, but this seems like a very tranquil audience. So I don't know what to do to make you turn up a little bit, but I guess when we get to the question and answering period, we'll feel like you're a little more turned up. What I'll do is provide a very broad overview of the action planning process that the teams went through, as Jenny said last year, but it feels like it was like last month or so. But have any of you actually done an action planning process before? Show of hands, pom-pom, anything? No? All right, so I just look at the action planning process. It's a tool, as Ashley mentioned. There's no one solution, but I would like to offer up action planning as a tool to help in your prevention efforts. And I look at action planning essentially as it's a blueprint, and it's a way to gather consensus among teams, especially diverse stakeholders. As already has been presented, we know that there's not one sector that has a responsibility for sexual assault prevention. So coming from my public health lens, I may have a certain appreciation of what we should be doing for prevention, but law enforcement, college campuses, and so on, there's going to be a different perspective. So the action planning actually helps to build, or the plan is for it to build consensus. So thinking about building consensus, so what we spent a core amount of time on at the action planning meeting was developing a mission and vision statement. So I'm sure many of you have done that before, correct? Yes, okay. How many enjoy it? You do? Oh, good. I'll have to say it's kind of like a labor of love for some people, but again, thinking about the diverse stakeholders at the table for these action planning teams, we wanted to make sure that everyone had the same mission and the same vision in mind. So with that, we wanted it to be very clear. So what do you want to do as a team, and why do you want to do it? Obviously, we were all there under the guise of preventing sexual assault because we knew that it was not inevitable, but it was preventable. But building more and going more deeply into that. So why? Why and what? Concise. We went through a few iterations, and actually we said it should be something that you technically should be able to, for the mission, not the vision, but you should be able to tweet it. So 140 characters, and maybe even have a few characters to spare. But I don't know about you, but I come from public health, and we tend to be very lofty in our words. And so this was an idea to really make it, so it's something I should be able to tell you very quickly in a tweet, or maybe now it's not tweeting, but Snapchatting or something, I don't know. So outcome-oriented, obviously. What's the goal of the team? Why is everyone there? Inclusive, thinking about the multiple sectors and defining the scope of it. So there were some teams, I'll have to pick on them, but Minnesota was not one, where they would have a mission statement, and then there would be like, and this is how we plan to accomplish the mission statement. So it was a way of trying to get more into it, but we were very adamant on really keeping it concise. So for example, one team came up with, their mission was to develop a collaborative network of allies focused on promoting a safe and healthy college community. So I'd say that's pretty tweetable, right? I don't know. And another team, I think this is definitely tweetable. Their vision was to empower Missouri campus communities to end sexual violence. So obviously it's very utopic in thinking, but that's tweetable, and it's very concise and straight to the point. So after we spent hours going through the vision and mission exercises, the teams then identified their priority goals. Again, coming from the different sectors, they all listed out the goals from that perspective, and they went through a ranking system. And after the ranking system, the team came together again as a collective and identified from that ranking system which goals would be the priority goals of the team. And then once the goals were prioritized, we then had to identify, okay, what, who, when, the resources, and the communication plan. So of the team or someone else, another stakeholder that maybe was not at the meeting, who was actually going to get so what do we want to do? What is this goal going to do, right? And who's going to do the work? That's usually the challenge, right? We all have these great ideas, and we obviously want to end sexual violence, but then you get back to your office and you have a whole host of competing priorities. So the idea here was to actually identify who would be doing what, and that was a way to provide some security that the goal would actually get accomplished, right? And so when will it happen? I know if any of you are like some of the projects that I've been involved in, there's no really timestamp, and I think in this instance, we definitely wanted to have a timestamp on it. So again, there's some level of accountability, not only to the organizers of the action planning meeting, but more so the accountability among the team members. And so resources, always, right? So not just financial, but again, if we can't do it as a team, who else do we need to pull in to help us get this accomplished? And then a communication plan, a communication strategy. I know oftentimes in public health we'll say people only think about public health when something stops working, but I think in this instance, sometimes we need to toot our own horn and communicate what our plans are, what we're planning to do, and kind of, pat yourself on the back a little bit. So that was a part of our discussion around the communication strategy. Then I'm sure you all have done a SWOT analysis before, right? Yeah. You can say yes. Thank you. I want to feel like there's some audience interaction here. Oh, great. That's what I want to hear. So, so what we did for the SWOT analysis, we didn't just do a general one for campus sexual assault prevention, but what we did was the 5 categories that Jenny mentioned that came out of the think tank. We did a SWOT analysis for each of those categories. So partnerships, evaluation, and obviously identifying the strengths, the opportunities, the weaknesses, and the threats. But another iteration of the SWOT analysis that we did, which I'm not sure if most of you have done, we did I think we called it flipping the SWOT on its head. So thinking about those threats and those weaknesses, but thinking about it from the framing of your strength. How can the strengths that we identify minimize our weaknesses, and how can our threats, and how can our opportunities minimize our weaknesses and threats, and so on and so forth. So looking at those kind of the weaknesses and the threats, and seeing how can we mitigate them early on, or anticipate what we have as a collective, how can we mitigate the negative impact on those. So as I mentioned, within the action planning team, we had 15 states, so you can imagine we had very diverse strategies, right? So there were some states that went on to do a mini action planning meeting. So the same thing that happened in Atlanta, they went and they replicated those meetings within their states. And those seem to have been very effective. Again, getting back to the communication part, not only communicating what your team has done, but how other stakeholders can do action planning and use action planning in their primary prevention efforts in particular. Violence Prevention Summit. So there were 2 states, I believe, who actually hosted a Violence Prevention Summit with a core focus on sexual assault. One of the other questions that we asked the teams was to think about, of the 5 sectors that they had at the table, if there were other sectors missing. Obviously, the answer was yes. So what some of the teams did was they then expanded their teams to include other sectors that were not initially part of the action planning process. And so that's where the coalition development came from. And a lot of them went through a whole coalition development, recruitment, and retention process. Something that we didn't think would come out of it, but it was great, was like actual classes on violence prevention that are taught at the university, both at community colleges and at four-year institutions. So that was an ideal win for us. And dissemination of the information. More so than just presenting what they've done, but disseminating in a way that would be useful to other stakeholders. So quickly, before I turn it over to Yvonne, I'll talk about some of the lessons learned. So I think it's no surprise here, right, that educating high-level decision makers is critically important. And I'm not sure if going through the action planning process, we didn't know that, but it was reiterated or at least corroborated in the process that the teams went through. The role of campus climate surveys and just data in general. So I'm a data geek. I'm an epidemiologist by training, so I love data. Not everybody appreciates it in the same manner, but thinking about the data that are collected, how do we present it in a manner that university officials will appreciate, that students will appreciate, stakeholders will appreciate, right? Not everybody's going to love a confidence interval, but I do, but not everybody, right? So the value of student input and thinking about it in a very comprehensive and intentional manner. I think a lot of times I'm thinking about the work that I do with youth in particular. Obviously, the problem that we're addressing directly impacts youth, so they obviously need to be a part of the solution. Same here for students and campus sexual assault. However, it shouldn't be haphazard, and you just shouldn't want a student, let's say on your coalition for the sake of having a student, but thinking about the type of input and where students fit in the prevention end of this. Pooling resources, obviously. Even when we're collaborating, sometimes there tends to be, I don't want to call them turf wars, but we work in our silos, which is cool. I think silos are okay. But what we need to get out of is staying in those silos. I think there are opportunities for us to transcend those silos, and that came out of, that's one of the lessons learned, thinking about pooling resources, transcending our silos to be complementary, and then you can get back in your silo after you've played nicely for a little bit, right? And then obviously, well, not obviously, but one of the things that I think that was super important was, I just said super, but that's okay, was highlighting the importance of prevention. So oftentimes, I know in the work that we've done, prevention is not discussed, or people don't fully understand when you say the public health approach to campus sexual assault or preventing campus sexual assault. There's still a lot of people with this this kind of antiquated idea that sexual assault happens even in college campuses and back alleys from strangers and things like that. So really educating from students upward on what prevention means and what is the prevention aspect for campus sexual assault, and really kind of, again, tooting our own horns. The data are limited, but there are things that work, and we know what's working, and I think it's our responsibility to continue to promote that, and that's one of the lessons learned that came out of the action planning process. So with that, I'm going to stop there. We actually do have, this is the actual action planning workbook that we have, and it's available online. So if anybody is interested, I can get your information, or we can share our information at the end, and we're happy to share a copy of that with you all. Thanks.
So I'm from Minnesota. So, and, yay. So I thought I would just start by setting the stage a little bit about where Minnesota was at in terms of campus sexual assault prior to the action planning, and then I'll talk about sort of what happened during action planning and sort of how we went from there. So in Minnesota, our coalition has a pretty robust public policy process, and so in 2014, we were looking at our policy agenda, and we were trying to decide, you know, what do we want to focus on. We tend to identify a few places where we like to be proactive. And campus sexual assault came up, but it was something that we decided we weren't going to jump on board and be proactive about, partly because the Campus SAVE Act had just gone into effect. Our colleges were telling us, give us some time to settle in, figure this all out. Let's not get some new legislation, blah, blah, blah. So fast forward to January of 2015, and we were, January of 2015, we were approached by two different legislators because this was a big topic. So one legislator wanted to look at affirmative consent because California had just passed affirmative consent, and she wanted us to think about that for Minnesota. And then we had another legislator who really wanted to look at it from more of a victim's right aspect and really look at, you know, what are we doing to ensure that victims have rights on campuses. So again, we were like, okay, we're not ready to dive in yet, so we tried working out some guiding principles to help guide legislators, and pretty soon we realized the train had left the station, and if we were going to have any chance to influence how the legislation turned out, we really needed to jump on board. So that involved what I would really call a crash course on understanding a lot more about what's going on with campuses, what's working, what's not working, so that we could really try to guide the process at the legislature. So in May of 2015, Minnesota passed a really comprehensive 9-page legislation addressing many, many aspects of campus sexual assault. We're most proud of our ability to influence things around training requirements, things around screening, and things around allowing amnesty for other sorts of code violations. So we were able to influence the process, and most of the legislation was going to go into effect in 2016. So when the action planning process came along, the timing was really good for us. We already were working on this. We weren't sure where we were going to go next with the legislation, and so we put together a team. On our team, we included 3 folks from campuses that we'd worked really closely with on the legislation. So Lee Ledoux from St. Cloud State University, Roberta Gibbons, who's done a lot of research on evaluation around what works for prevention, and then Tracy Thomas Card with our largest system, the University of Minnesota, along with myself, and then Amy Kenzie from our Department of Health. So while we were at action planning, Jenny mentioned that we were locked in there for a couple of days. We really literally couldn't leave during the day. So we put our hats on and we got to work. But so one of the things we did is during the SWOT analysis, I think we started to really see all the places where we had a lot that we could build on. So we had the legislation that we could build on, we had some partnerships we could build on. So, we started to feel like, oh, there's a lot of ways that we could go with this work. And I will be honest, we consistently tried to rein in our own ideas and expectations because probably like many of you, we all had work plans. We all had, our whole lives were figured out, and we did not necessarily have room in our day-to-day lives to add a whole new thing. So while we were in the action planning, we decided to really focus on trying to get our governor to put together a task force similar to the president's task force. We thought that would be doable, it'd be a nice way to bring all the right people together. And so that was, when we left, that was what we left planning to do. I will say, from the action planning, three things that were super helpful to us were, we all heard the same information. So there were a number of presentations like the scan, like the report from the expert gathering. So we started with a base of similar information. I mean, another big part was we spent a lot of time together. So our team of 5, we knew each other, but just being together for 2.5 days, we traveled together, we ate together, we were in there together. I mean, I think it created relationships that made going forward a lot easier because we knew each other really well. You could talk in shorthand, some of that kind of stuff. So that was really important. And then, I thought there was one other thing I wanted to say. Oh, we also created that list of tasks that Mighty talked about, which I think is so huge, because I know if you're like me, I'm gonna leave here with a notebook full of ideas that I may never get to because I haven't created an actual plan. So we split up the work and decided who was gonna do what, and we left knowing that we had deadlines of things that we had agreed to accomplish, and I think that was super helpful. So after we got back to Minnesota, we quickly realized that the governor's task force idea just wasn't getting any traction whatsoever. So what we decided to do at that point was to broaden our planning team by inviting some other key partners that we had worked with on the legislation, as well as some additional campus representatives. And so in Minnesota, we have a private colleges council, which represents all of our private colleges. We have the Minnesota State Colleges and Universities system, which represents all of our 2-year and 4-year public colleges. We have the University of Minnesota system, which represents just 4 of our big universities, our land-grant universities. And then we have the Minnesota Career Colleges. So we brought representatives of all of them together along with other folks who were just interested in helping to plan this and started talking about, where we should go next. And pretty quickly we moved to the idea of doing a campus summit. And I think part of the reason we chose to move quickly with the campus summit was we had the looming deadline of the legislation that went into effect just this past August. And so campuses this was on their radar. They really cared. They needed resources. And so the summit became a tool that we could use. We also just, as a way to use data for decisions, we did a quick survey of all of our campuses to see, would they be interested in attending a summit? What kinds of topics were they interested? What was priority issues for them? And then did they have suggestions of speakers or workshop leaders that they would like to see us work with? So we gathered all of that information. So here's our student-designed logo for the summit, which we held June 9th and 10th. I wanted to just say a couple things. While our initial focus was on sexual assault, because campuses are dealing so much with sexual harassment, dating violence, and stalking, we expanded the vision to really cover all 4 of those. So we made sure that we had topics on all 4 of those areas. And then as we moved forward, our action team sort of functioned as the executive committee working with the broader Sexual Violence Prevention Summit Planning Committee. So our purpose is not tweetable, but it was so important to us. So we really focused on, we wanted to share best practices and experiences and create shared community. And so one of the first things we did as this broader planning committee was decide what was our purpose and what were our goals. And I will say that I was the convener of all those meetings, and I included that on the top of every agenda as that committee met, because it is so easy when you're working on a big topic like this to get all excited and want to head in a lot of different directions. And so our focus really became on that whole sense of shared community. I also wanted to say Minnesota's a large state, and we had over 100 campuses that are covered by the legislation. So we knew we were dealing with a pretty broad number of campuses. So our goals were really focused on what we saw as tools you can use or practical resources. And so when we were putting together the agenda, we wanted to make sure that people would leave with things that they could put into place on their campuses once they got home. And part of that included really developing relationships. So developing relationships with folks in their own campus, but also developing relationships with nearby campuses, or identifying resources that they could maybe bring into their campus if they were looking for speakers on different topics. One of the challenges, I would just say that this was an all-volunteer effort, so everyone who worked on it, all of our presenters, really everyone volunteered their time. And so for that, I think it went extremely well. I think we were really lucky that we were able to pull it together as quickly as we were, and that we were able to really engage so many people in working with us on this. I wanted to talk about a couple decision points, because when we first started working on this, we knew we wanted to focus on prevention. That was, where our hearts were. And we knew that if we didn't address response 2, it would be difficult for campuses. So we started actually thinking we would do a half day of response and then a full day of prevention. And pretty soon we moved into realizing, well, we don't want to silo it like that, and we don't want to encourage people to only come for the response day or only come for the prevention day. We did work with our site had some meeting planners who helped us with some of the details, and they said, you never want to split it up if you don't have to, just give everybody the full amount, have them come for the day and a half, they'll choose whether they want to stay, and so we ended up having having it be a mix of prevention and response. We really worked to address all of the areas that the new legislation covered, because we really wanted this to be a resource for them, because they were required to have certain kinds of trainings. A challenge for planning was this being the first one, we really didn't know what sort of response we would get. People had said they were interested, but we didn't want to sign a contract that required us to have 250 people there, because we just weren't sure that we could get 250 people there. But we did have people come. So as soon as we announced registration, we had over 200 people register, and then we kind of stopped promoting it after that, because we had a limit of 310 for the space that we had. So that was an area that we could do some changes. I also wanted to just mention, I think as with a lot of other states, and I think generally on this topic, we really worked hard to connect our campuses with our local rape crisis centers, and that worked in some places and didn't work in some places. I think that is an area still for a lot of challenge. So that's something that I think is on our agenda in the future. One of the things we did was we really wanted to encourage people to attend as teams, and so we did registration incentives to encourage them to attend as teams, and that really worked. So we were really pleased. We only had 5 campuses where they brought one person. The bulk of our campuses either had 5, 6, 7, 8, or 9 people on their teams. So, and that was very important to them. And some of our evaluations said that what they really would have liked also would have been opportunities for them to meet as a team at the summit, and I think to almost do some of the kind of planning or deciding what's going to happen next piece. So that was really important. So we had over 300 people from 57 colleges attending. So we were really, really pleased about that. We had everything. We had a culinary institute there. We had our largest campuses there. We had a lot of our 2-year campuses. I think Ashley mentioned, I think that is at least in our state, that's a group that struggles more, because most of the people whose work is involved in this, it's just a small part of their job, and they don't necessarily have a lot of background or experience. So it was nice to really connect all of them. Jenny was one of our keynote speakers, so that was very fun to have her there. And I think I mentioned, but I'll say it again, we really made the conscious decision to use Minnesota resources. So most of our, except for Jenny, all of our workshop leaders were folks from Minnesota, really wanted to highlight the experience that we had in Minnesota, and again, really wanted to make it accessible for people to connect with resources locally on what's going on. Oh, the other thing we did is really focused on policies and practices and not only on specific programs and services. And I think with prevention, as was said already too, I think that is challenging because I think people really just do want a program in a box. You know, just tell me what to do, I'll do it. And it's just not quite that easy. So we learned there's a lot of interest. We had tremendous media coverage. Our summit was held a couple days after the Brock Turner case, and so literally all 4 of our TV stations, I mean, if you ever do media and you send out a press release and you don't do any follow-up, you know, you don't ever expect anybody to show up. We had all 4 TV stations. We had radio, we had our major newspapers. I was invited to be on our Channel 2, our public TV, public affairs thing, all because of the timing, and that was just pure luck on our part. But it is, we have really, I think, it has really enabled us to position ourselves as a resource on this, and so there was another whole series of articles and news coverage August 1st when the legislation went into effect. So we're seeing us being called more often as a resource, and we're seeing people being really interested in what's happening around campus sexual assault in Minnesota, especially with the legislation. So what's next? We did an evaluation of the summit, and we're in that sort of awkward phase of deciding, do we have enough energy to do another summit already again next year? I think all of our campus folks were like, yeah, when's the next one? And so I think we may build on the momentum from this first year, do another one, and then after that maybe switch to an every other year. But that's sort of where we're at with our process. Thank you.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.